Dear students, we will discuss a topic that is instrument. Just check what this instrument is. Look at this. We can see that lengthy instrument. There is a round in the tip, maybe volley tip or round bullet-like actually bullet-like tip, and it is flexible. You can see that you can bend it. Is you can bend this instrument. It is flexible. Very strong instrument, and tip is bullet-like. So, what is this instrument is? This is baked CBD dilator. All of you know that when you explore CBD, after opening the CBD, that is called as choledochotomy, especially when there are CBD stones. Sometimes there is CBD stricture when it is there. Once you open the CBD is usually opened with a longitudinal incision, just distal to the where it joins the common hepatic duct and above the level of the the duodenum, and it is opened longitudinally actually, and once you open that, multiple stones are there. You use D-Jardin's choledochotomy forceps. I have seen that, and once you remove all stones, give a proper normal saline wash proximally and distally, and then pass this dilator, bakes CBD dilator. You can bend it, flex it, and flexibility. You can bend, negotiate, and whatever the curvature you want. It's flexible but strong, and retrieve the retained CBD stones either distally or proximally. And also in the distally there is a stricture. You can confirm the resistance will be there, and also you can confirm that it has gone into the duodenum. So in the second part of the duodenum, if you feel, you can see the bulb or bullet tip actually, volute tip or bullet tip actually. So it will be able to feel when you feel the second palpate the second part of the duodenum on table. It confirms that there is no block or no more stones. So CBD is patent till its opening to the sphincter of OD. So that is what exactly different sizes come: small size, medium size, or 3 millimeter, 13 millimeter size. Different companies manufacture this baked CBD dilator. So sizes also different, usually 13, maybe little more or different depending on the manufacturer's companies. It is so it is. If you want to be able to negotiate, then won't be able to place a T-tube there. You know that carries a T-tube is placed there to drain it once you open the CBD. Always you have to do that, keep it for 14 days. But if there is a stricture, then you have to do a hepaticojejunostomy or choledochojejunostomy. It's communicate common bile duct into the loop of the jejunum. So the diversion occurs and bile drains through this hepaticojejunostomy and jejunostomy. So that is the idea of confirming. It's a very useful, essential instrument. Essential instrument bakes CBD dilator. So you can go through my instrument chapters, and both it is there in clinical methods in surgery and manual of surgery instrument chapter. This instrument is there, lithotomy forceps, D-Jardin, D-E-S-J-A-R-D-I-N, S is silent, lithotomy forceps also there. You can always go through my instrument chapter in both books, clinical and manual, and have the idea about this. And students, please go through this MCQ, put the right answer in the comment box. I will acknowledge your answer, and also don't forget to subscribe my channel, and also share my channel with your friends and colleagues and others, and it will be very, very useful. Daily 5 to 10 minutes lectures daily will be there in my channel related to the surgical topics. Very, very useful. It will upgrade your knowledge, surgical knowledge. Daily, day-to-day basis, you can have the regular knowledge about the different topics of topics in the surgery. Very, very useful. So again, I requesting, please subscribe my channel and share with your friends, and press the bell button, and also inform others. And so identify this instrument. So A, B, C, D, put the right answer in the comment box. It's very useful instrument again. And second MCQ is identify again this instrument. What is this? Doyen's intestinal occlusion clamp, Pear's crushing clamp. Cocker's crushing clamp, Moynihan's occlusion clamp. Put the right answer in the comment box. Again, I request students, please subscribe my YouTube channel and share with your friends and upgrade your surgical knowledge. And also at regular intervals, we'll have live sessions for 1.5 hours through some students will present clinical cases. So we'll have a very interactive session. Join for this live session. Senior professors also will join. So you can put your questions in the chat box and you will get the proper answer. And very, very interactive and very useful for your practical exam. So join this live session also. If you join live session, you will get a certificate for that. It's also very, very useful in your future career. So always look at the notifications for the regular weekly or once in 2 weeks live sessions. It's very, very useful, especially for your practical exam. So quotation of the day is: failure is the part of the success, not the opposite. Don't get depressed by the failure, because it may be the beginning of the, you think more, do something else to have a success. Rather, it's the beginning of the success. Consider it as the beginning of the success. Don't get depressed. That is what exactly it meant. It is very, very useful quotation for surgeons, because many times failure is very, very common in surgical field. But eventually you will succeed and become successful based on your correction, what you do because of the previous failures. And so students, again, please go through my SRB's Manual of Surgery. Very, very useful book. Covers all CBM syllabus, and both undergraduate and PGs are very useful. There are quotations, everything is covered: general surgery, cardiothoracic surgery, specialties, urology, neurosurgery, GI surgery, endocrine surgery, thyroid, breast, parathyroid, all topics, whatever there is CBME syllabus, with the instruments, anesthesia, basic operative surgeries, everything covered with all photos, illustrations, management policies, principles, clinical features, and definitions. So everything is covered as for CBM syllabus. Very, very useful. So take my service manual surgery current edition. It will be sufficient for your exam. And also my clinical methods in surgery with the video of examination, all different cases like hernia, thyroid, breast examination, and varicose vein, vascular disease, and so on, mass abdomen. And every topic is covered for how to examine a patient, and the differential diagnosis in the tabular form. But there is no management. But it's a mainly clinical book with a lot of photos. So very, very useful with the video of how to examine a patient. It is very, very useful to all students who take practical exam, clinical examination, which is very detailed and with the clinical principles actually. So with lot of photos about the examination. So SRB clinical methods in surgery with the video lectures. So it also contains instruments, specimens, images also. It will be again useful for practical exam. So please take my clinical method surgery other than operative surgery book is there. 2-volume, very voluminous book, which is very useful to you for understand all surgeries in detail, step by step, with more than 10,000 photos and illustrations. Again, useful. My class of the surgical operation shows how to do surgery, suturing technique. With video lectures, it's also very, very useful. Again, students, my digital lectures are there through JP Publishers. All lectures, around 220-hour lectures, everything is covered. Instruments, clinical examination, all topics, basics, GI, everything as far as specialties, everything is covered with the proper lectures. Very, very useful for you people. So please purchase my 1 year digital lectures. It will be useful to cover everything for as far as surgery is concerned. To take exam both for UGs and PGs. Again, please subscribe my YouTube channel, my all channels, and also share with your friends, and daily go through my 5 to 10 minute lectures with the MCQs and quotations. Will be very, very useful, very good, and enjoying subject, enjoying for you, because the day to day you can upgrade your surgical knowledge, etc. And also join my live sessions at regular intervals for your more information as far as especially for practical exam. Students, I hope you have understood this lecture very well. Thank you so much.